Assalamualaikum. My name is Noraina Fareha. I'm a student in Diploma in Nursing. So today I want to talk about vaccination. Firstly, immunization is a global health and development success story, saving millions of lives every year. Vaccines reduce the risk of getting disease by working with your body. Nature defends the world protection. When you get a vaccine, your immune system responds. We now have a vaccine. Have a vaccine to prevent more than 20 life-threatening diseases, helping people of all age lives longer, healthier lives. So now, not only in Asia but all over the world, there is an extraordinary pandemic, that is COVID-19, which has happened in early 2020, which is every scary all of the world. But now there is vaccine to prevent from many deaths up to millions for age 18 and up. So, for children, can they be vaccinated? The American Academy of Pediatrics recommends COVID-19 vaccination for all adolescents 12 years of age and others who have no contraindication to the vaccine. Based on data released by the Center for Disease Control Prevention (CDC), the AAP is tracking progress in vaccinating U.S. children under the age. COVID-19 childhood vaccination collected on August 25, 2021. The CDC recorded 11.7 million U.S. children under the age of 18 had received at least one dose of the COVID-19 vaccine, represent 59% of children aged 11 years and 48% of children aged 12 until 15 years. 8.8 million of the children were fully vaccinated, represent 45% of children aged 16 until 17 years and 35% of children aged 12 until 15 years. COVID-19 child vaccination trends. Nearly 500,000 children received their first dose of COVID-19 vaccine. Children received the first dose decreased for the second week in a row. The number of weekly first dose vaccination was still well below the 1.6 million peak at the end of May. Childhood vaccination rates vary greatly in each state. There are 72.8 million children under the age of 18 in the US. 2020, 22% of the population. Children under the age of 12 are not yet eligible for the COVID-19 vaccination, which represents 15.5% of the US population. So what we are seeing now is that vaccines are very important for all groups regardless of age, young and old, because they are also susceptible to COVID-19 virus as well. But for children under 20 years, there is still a lack for vaccination and may want to be studied in more detail. However, vaccine is very important. Therefore, it is important to be vaccinated and should also take care of the SOP, which is stay away, social distancing, wear a mask, and do not have to go out if there is no important affair. So, stay healthy, stay safe. Thank you. That's all for me.